Group 2 proudly presents an overview of a systematic review using the Prisma checklist. In this video, we will be discussing what is a systematic review and its importance, what the Prisma is and its purpose. We will be providing an application example using Kegohara and colleagues' article. Let's review some basic concepts. So what is a systematic review? Well, systematic reviews present a comprehensive analysis of a full range of literature on a particular topic, typically an intervention, diagnostic test, or prognostic factors. Its purpose: systematic reviews are used to examine effectiveness of interventions, accuracy of a diagnostic tool, or identification of prognostic factors. You may be thinking that sounds a lot like a meta-analysis. Although systematic reviews and meta-analyses both review and analyze multiple studies, a meta-analysis includes a statistical synthesis of data. Now back to talking about systematic reviews. Why would you want to apply a systematic review to your clinical practice? Well, thorough systematic reviews provides evidence for decision-making that inform practitioners' clinical practice. Now that we've learned what a systematic review is, let's check out a critical appraisal tool for systematic reviews. The preferred reporting items for systematic reviews and meta-analyses, also known as the Prisma for short. The Prisma focuses on the reporting of reviews, consists of a 27-item checklist and a 4-phase flow diagram, which are deemed necessary for transparency when performing a systematic review. You may wonder what the purpose of a Prisma is. For authors, it improves their reporting in systematic reviews and meta-analysis and ensures that the review is complete, transparent, and comprehensive. For journal peer reviewers and editors, it is useful for the critically appraising systematic reviews. As clinicians, we can use it to inform our decisions and evidence-based practice in our clinical expertise. Now, let's apply the Prisma. Before continuing, ensure that you have a copy and have read the Kegohara and colleagues' article to follow along with. The authors conducted a systematic review of studies that involved iPods, iPads, and related Apple devices in teaching programs for individuals with developmental disabilities. The primary aim of the review was to inform an evidence-based practice of the use of iPod and iPad-based instruction for individuals with developmental disabilities, with a secondary aim of identifying gaps in the existing database to stimulate future research in this area. The search yielded 15 studies covering 5 domains: academic, communication, employment, leisure, and transitioning across school settings. The results of the 15 studies were largely positive, suggesting that Apple products and related devices are viable technological aids for individuals with developmental disabilities. So how do we know that this is a systematic review? You've already learned what a systematic review is, but how do we know that the Kegohara and colleagues article is actually a systematic review? Besides the giveaway of the article's title, it follows the specific process of a systematic review. It states the objective, develops a protocol which determines inclusion and exclusion criteria, develops a search strategy, searches for and retrieves relevant papers, screens and selects papers and evaluates the quality of the studies, and finally, analyzes and synthesizes findings. After using the Prisma checklist to critically appraise the article, here are our findings, starting with the strengths. Firstly, the title accurately identifies a study as a systematic review. The authors provided a good rationale for their study area of choice to review, including the potential contribution of the review to academia and future educational strategies for individuals with developmental disabilities. Despite the lack of rationale for inclusion criteria, the authors did provide clear and specific inclusion criteria. Another strength is that the discussion. The results summary was presented coherently and drew good conclusions. The authors considered the results' relevance to key groups including healthcare providers, the education system, and individuals with developmental disabilities. The author also provided insight into future implications for the use of technological devices in educating people with developmental disabilities. The final strength identified was the author's recognition of potential limitations in their findings. They discuss that individuals with more profound and/or multiple disabilities were missing from their review, suggesting that those with significant motor impairments may not benefit from the device use. Additionally, they recognize the studies do not focus on social skills and daily living skills, which are important for the client population. The Prisma is helpful to critically appraise if a systematic review meets certain expected standards. However, we have also identified some key article strengths unrelated to being a systematic review. 1. The selective use of Apple products allowed for better comparison of adaptive technology in the results, as opposed to comparing Apple products to Microsoft products. 2. Only articles that included empirical data on the effects of Apple products were reviewed. 3. 100% consensus among multiple reviewers was required for a study to be included. And now, here are some key article weaknesses identified. Please follow along with your copy of the study and your Prisma checklist. Overall, there were aspects of the study that did not fulfill the criteria identified within the items on the Prisma checklist. Out of a 27 total item, 9 items could not be found. More items were only partially complete. For example, item 5 on the checklist, there was no systematic review registration number. Therefore, the review protocol is inaccessible. This is an issue because readers cannot check to see what the researchers' selected primary outcomes were. Choice of selected outcomes can impact the choice of literature and cause bias in the review findings. Furthermore, the search strategy, item 8, was not detailed enough to be reproducible. The minimal details provided in the methods section makes it difficult to reproduce and verify results with decreased transparency. In addition, the article lacked identification of biases such as item 12, risk of bias of individual studies, and item 15, risk of bias across studies. Other checklist areas of bias such as item 19 and 22 were also not addressed. For instance, the article only included English studies. Therefore, the results could not be transferable to non-Western and/or English-speaking countries. Due to these biases, there is reduced internal and external validity. Moreover, the systematic review included the author's own articles as a study, which presents biases and may further weaken internal validity. Another weakness is that the article only investigated the use of Apple products. Although this use strengthens the internal validity, not everyone has access or uses Apple products. Therefore, it weakens the external validity. Additionally, since the funding of the article was not reported, there is potential bias towards the results if the article was funded by Apple or a competing brand. Another article weakness is the limited domain areas investigated. A majority of the articles investigated academics and employment skills. Yet social skills, which is a vital component of adolescent development, was lacking among the included studies. Furthermore, a small number of studies were used in the systematic review, thus limiting the reviewer's internal validity. Overall, these weaknesses do not pertain to the article as a systematic review, but rather as a general investigation. So as an occupational therapist, why is this article important to you? This article provides insight into using the use of Apple devices with individuals with developmental disabilities. Developmental disabilities affects an individual's behavior. Therefore, it is crucial to find different ways to enable this population to succeed in school. Occupational therapists can use the review's results to help their clients make informed decisions about interventions and treatments and apply evidence-based practice. Since the publication of this review, other articles have further explored the use of technology to enable learning of people with developmental disabilities. For example, Neely and colleagues compared the effectiveness of methods of academic instruction delivery using traditional materials versus an iPad. They found that the use of an iPad decreases challenging behavior. As you can see, this research area has a direct relevance to an impact on the field of occupational therapy and occupational science. However, as Kegohara and colleagues discussed, this research area requires further investigation to understand the benefits of these products for individuals with developmental disabilities. A systematic review is beneficial for evidence-based practice and informed decision-making. The Prisma is one critical appraisal tool that can be used to evaluate systematic reviews. The Kegohara and colleagues article had a good rationale and discussed the results and conclusion well. However, there were several weaknesses, which included the lack of discussion on potential confounding variables and biases, as well as many Prisma items were missing or only partially identified. This may seem like a lot of information, but the main takeaway is, although the Prisma tool is useful for critically appraising systematic reviews, it is not a quality assessment instrument. On behalf of Group 2, thank you for watching. We hope you have learned a little bit more about systematic reviews, the Prisma tool, and its application.